Are you a medical or healthcare professional who sees people with chronic pain? Do you struggle to cover everything you need to within the short appointment lengths that you have? Helping people with chronic pain can be really difficult within 10 or 20-minute consultations. So in this video, I'm going to let you know about the 4 most effective ways to help people with chronic pain in less than 10 minutes. Hey friends, welcome back to the channel. If you're new here, my name is Mahin and I'm a physiotherapist specialising in pain management based in the UK. Today I'll be going through 4 ways that you can help your patients with chronic pain in less than 10 minutes. So let's get into it. Like with any consultation, the first thing to do is to ensure that you're the right person for that patient right now. If you're not, then a referral onto another professional or another service may be needed. However, once you've screened for any serious or systemic conditions and any associated red flags, move away from a diagnostic assessment approach to a conversational assessment approach. There are then 4 main areas to cover during the appointment. So most people with chronic pain will have seen many different professionals over their many years or even months of pain. Now, the most commonly reported cause for dissatisfaction after a consultation is that the patient reports that they did not feel listened to or fully understood or even taken seriously. So we have a real opportunity the first time we meet someone in pain to be different. And that's through listening, reflecting, and validating the person's experience of pain. I really want to highlight here how this is the most important thing that we do the first time we meet someone living with chronic pain. If we do nothing else within the appointment, obviously we want to make sure we're safe, so make sure there's nothing serious going on. But once we've done that, this is the most important thing. If we're not doing this, if we're not taking the time to do this, then actually we're not going to get far later on down the line. So take the time in the first appointment to listen and validate the person's story. And remember that the patient is always the expert when it comes to their pain, okay? So it's our job in that first consultation to understand their pain experience and their journey. So because we're going to be doing a lot of listening in that first consultation, it's really important that we focus on our non-verbal body language. And this might be things such as nodding at appropriate times, smiling when we need to, moving in our chair, so kind of moving from a more sitting back, relaxed approach to leaning forward, showing that we're really intently listening, and also showing emotion at the right times as well can be really, really key. It's also important to show active listening by asking the patient questions to gain some more clarity and also summarizing at the end what they've just told you to show that you've really understood what they're said. So this is setting expectations for both management and for the prognosis as well. So what I mean by this is, have they come to see you for a completely different reason to what you're able to offer? So perhaps they've come to see you for some TENS or some acupuncture, whereas really your focus is more on kind of self-management strategies for pain. There, if we don't address that early on, can cause a little bit of a barrier and a little bit of friction between you and the patient because you have different expectations for treatment. The other thing is prognosis. So let's say that someone comes in to see you and they've had pain for 20 years and they're expecting for you to get rid of their pain. That might not be a realistic aim. So it's really, really important that we address that early on. And understanding the patient's journey and expectations can also provide a really, really good insight into the level of acceptance that they have around their pain and what stage of change they might be at as well. It can also provide an insight into their willingness to move forward with their pain. So are they still looking for something that's going to control the pain, or are they looking for help now in living well with that pain? And all of these bits of information can also help our future discussions, because when we've listened back to the patient's story, if they say, for example, that they went through a particularly stressful time and that tend to flare up their pain, then actually we can draw back on that later when we're going through a little bit more of education to say, actually, you told me earlier that stress caused a flare-up of your pain. So we can see how here it's not just structural things that cause pain, it's also other wider factors like stress that can cause some pain. They may have also mentioned some of the treatments that they've tried that only had a short-term effect. So again, if their expectation from you is to provide another one of those treatments, we can draw back on that later and say, but you did mention to me earlier that you've tried this before and it didn't really work for too long. Do you think it'll work again? And this provides a really good way of opening up some new avenues for discussion and also new ways of looking to approach managing their pain. Anecdotal evidence from their own experience is so much more powerful than the research evidence we have, so hold on to that and make sure you're using that to yours and the patient's advantage later on. So setting expectations for the time that they are under your care is really key, because don't forget, at the end of the day, this is a partnership. So we want to make sure that we're both on the same page here there's no point in us having different agendas and looking to go down different routes, because we're just not going to meet up anywhere that's going to be beneficial for the patient. So we need to make sure we're on the same page, and the first appointment's a great time to do that. Don't forget that living with pain is very distressing, and especially when tests and investigations are coming back and not showing an explanation for pain. So again, it's really important to be honest with the patient and say that there is a possibility that there may not be one particular answer or one singular cause for their pain. Saying that early on really kind of helps them to see that actually maybe there isn't tests or investigations that are going to show their pain, and actually continuing to go around in this circle of looking for answers for the pain can actually be a little bit more counterproductive and use up valuable energy that they do have. Rather than looking at ways to live with this pain and move forward. And again, if they've had pain for a number of years and this pain is chronic pain, also opening them up to the possibility that this pain may never go away completely. This can be a really, really powerful point in the conversation, because although it can be quite hard for the patient to hear initially, and even for us to say, it's an important step in helping them move forwards with this, because improvements can be made in their quality of life and their function, even if there isn't a significant pain reduction. Recovery looks different for everyone, okay? And recovery doesn't have to mean pain reduction. It can be helping them return to the valuable things that they want to do in life to improve their quality of life. So in my previous videos, I've spoken about this really important shift from what is the matter with me, which is this diagnosis-driven, pain-controlled approach, to what matters to me, which is more of a value and goal focused approach. And this shift is so important because struggling for pain control is the best predictor of worsening pain, greater disability, worsening depression, and also greater avoidance as well. So it's really key that we facilitate patients through this shift. One of the ways to start this off is by reflecting on the previous treatments that they've had that I mentioned before. So by doing this, they can see in their own experience how chasing those treatments to control the pain have actually not led to any long-term benefit to their pain. And a lot of the time, those treatments come at a cost. So that cost might be the energy that they're having to put in to go through those treatments, but also financially as well, because these treatments can be quite costly, especially if they've had to seek them privately. And because pain's often along for the journey, the more time, energy, and resources that we're spending on trying to control the pain with these treatments, the less time, energy, and resources we have to spend on the things that are important and meaningful to them. So reflecting on their previous treatments and the outcomes that they've had can help them see that there is no one cure or fix for pain. And they are likely to know this anyway because they've been through this. And if they had found that one cure or fix, they wouldn't be sitting in front of you today. So it's a really, really good, easy way of getting the patient to see how those treatments aren't effective in the long term, because often they've got their own experiences of that. So once they've seen that, then we can offer a different approach in helping them try to return to their important and meaningful activities in the presence of their pain. So rather than trying to control the pain before going back to doing things, it's actually more about, okay, let's try to get back to doing things. And often along the way, the pain actually becomes better managed because we are just generally more happier, and our pain system is less sensitized, less protective over time. So actually this is more beneficial in the long term for pain when we actually start off working towards these goals in the presence of the pain. When we're setting goals with patients, we want to make sure that we're keeping them functional rather than pain specific, because the pain specific goals of, I want to reduce my pain is often not a great goal because there isn't one quick way of doing that. So actually, by shifting the focus onto something more functional, it gives us a clearer set of steps to take to achieve that goal. And if you find that your patient is really, really fixated on the goal of pain relief, then you can ask them some of these questions. So this is something I ask my own patients. If I had a magic wand to get rid of your pain, how would your life look different? Can we begin working towards this in the presence of pain? Another question to try and elicit some functional goals would be, what did you previously enjoy that you would like to return to? And also, what important activities are you struggling to engage with currently? So getting them to focus on, okay, so potentially there's pain here, but what is pain stopping you from doing? And it might not always be possible for us to be able to get them back to what they were doing previously, okay, because life might look very different for them now. But what it does is it helps to elicit some values that might be underlying, okay? So if someone used to go to the gym 4 times a week, that might not be a realistic aim for them now, But underlying that goal or the activity of going to the gym 4 times a week was actually that they had a real value of keeping themselves healthy. So is there another way that we can help them stay in touch with that value of being healthy that might not be going to the gym 4 times a week? It might be, swimming, it might be walking, it could be any activity that they now enjoy that previously they didn't enjoy. And as mentioned previously, often these big goals that we set can feel really unachievable and quite daunting at the start. To help patients break down those big goals into short-term goals that they can achieve in the next week or month to get that ball rolling and get that first small win in. And this short-term goal can then be broken down into an even shorter kind of daily action that can be taken. So let's say that a patient has a goal of being able to walk 20 minutes to the park to take their kids there to the park. And let's say they want to be able to do that in 3 months' time. It might be that we actually set the daily task of just doing a 5-minute walk daily and building up from there. 20 minutes might be a big jump, so make sure that we're setting something that's achievable, to do daily or even to achieve in the next week, so they can start to see the progress that they're making. To know how we can hit the sweet spot with that daily action is we can get them to think about their baseline, and this takes a bit of experimentation sometimes from the patient. So I usually define a baseline as an amount of activity that you can do, and when you stop, you feel like you could do a little bit more, okay? And that's a good way of setting a baseline, because it often gets people to do slightly under what their limit is, which is a good starting point, because it's always easy to start off low and build up rather than going in too hard, having a flare up of their pain, and then they're put off from doing that activity again. So I usually say, try this 3 times. So start off with something you feel is comfortable for you. So let's say that person picks a 5-minute walk. They do the 5-minute walk, and actually they find that that's really, really easy. So the next day they do 10 minutes, and actually they find that's too much, and they have a bit of a flare up of their pain after, and it stops them from doing the things they want to do later in the day. So actually then on the 3rd day, they might do 7 minutes and actually find that that's the right level for them, and they found their baseline then. And one action is enough for them to focus on before they next come to see you. So again, a big mistake that we make is we try to cram loads of stuff into the back end of a consultation. So they've come to see you, we've only got 10 or 20 minutes, we've done the assessment, we might have rushed to do an objective assessment, then we're rushing to print off a sheet of exercises or prescribe a medication because we feel we need to give something in that appointment. Focus on one thing. So if you get this far, okay, and you have set a plan with them for the next appointment, one thing is enough for them to focus on. The more that we put in, the less likely someone's going to do something, the less meaningful it is. So pick one thing that's going to help them move towards their important, meaningful goals and just get them to focus on that one thing. It's really important that they start off small because we want them to achieve a small win quickly, because that gives a kind of a real positive feedback to the patient, and that causes a positive feedback loop, which then makes that behavior automatic in the future. So pick one thing, do that one thing well, and make sure it's starting off at a level that is achievable for them. Okay, so we've been through listening to understand the patient's journey, understanding and setting expectations, and identifying what is important to the patient. This may already be enough for the first appointment, but if you're really doing well for time and things have gone really, really swimmingly, then the 4th thing is agreeing a management plan. And this management plan is in collaboration with the patient. So it might be that it's actually explaining what your service or you as an individual can offer to them in the future sessions going forward. And if you actually find that you're not the best person, or your service isn't the best for this patient right now, then it might mean that you're referring on to a different service. So that might be physiotherapy, psychology, or even a pain management service if you do have those in your area. So the first part of the video today, I talked about how it's important initially to identify whether you are the right person for the patient in front of you at this time. And it's okay if you're not, because there might be other services that are more suited to helping this patient at this time, and identifying that early, that is absolutely fine, and you can refer on if need to. However, if you are going to continue future sessions with this patient, then link back to their journey, their expectations, their values and their goals, and make a plan for your future sessions coming up. So say, okay, well, next time I see you, we will discuss this, or we'll check how this has gone on, and we'll build on that, and just make a clear plan from what's come out in that initial consultation, so that the patient knows when they come to see you next time that that's what's going to be discussed. Again, it's just keeping on the same page with each other, which is really important for that relationship going forwards. So you'll see from the points that I've mentioned in this video that in that first consultation, it's actually less about doing and more about listening and understanding the patient's journey and helping to set up an ongoing potential future relationship that you're going to be having together. So identifying those expectations, those values, those goals for the patient. And often less is more in any consultation. We try to overcomplicate things at times, and that can be confusing for us and also for the patient. But take the pressure off both of yourselves and, focus on those things that are really, really important in that initial appointment. Get rid of the nasty stuff, make sure you're screening for all the serious pathologies, make sure you're the right person for them, but after that, listen to the story, identify those expectations, identify what's important to them. And if you are still struggling for time, just take the first 2 points from today's video. So listening to the patient's journey, and understanding and setting expectations. If you can do those 2 things the first time you're meeting a patient, that is absolutely great. And they are the 2 most important things we need to do initially. There's no point jumping ahead and doing all the other stuff until those 2 things have been done. So get those 2 things done, get them in for another appointment if you need to, or refer them on if you need to, but get that initial work done because that is so important and that's going to help you in the future with that patient. And if you are only just covering those 2 things in the first appointment, send them away with the task of thinking about what is important to them before the next time they come and see you. So they're almost doing that work in the background, and then when they come to see you next time, they already have those answers for you, because that can sometimes take a bit of time in eliciting, what is meaningful to them, what activities they want to get back to. Don't feel like you need to rush and fit that into that appointment if you're running out of time, because again, rushing just kind of depletes that therapeutic relationship that you've got with them, and it can kind of kill any rapport that you might have built with them. So friends, if you liked today's video, then you'll find this custom playlist I made for you helpful as well. Now this has all of my top videos that I've made for professionals working with people with chronic pain. And a lot of the information and the content that I've got in these videos is taken from training sessions that I've delivered to healthcare professionals. So be sure to check that out. Thanks for watching, take care, and I'll see you next week.